Good morning and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Catherine Berg. I'm a research study coordinator with the Havey Institute, and I'd like to welcome you to this week's episode. I'll be leading today's discussion. I'd like to welcome Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing great. Thank you.
Dr. Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, public health, and infectious disease questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions, addressing the latest headlines and our lone U.S. COVID statistic through today, May 9th. We will start with that COVID statistic. The average COVID deaths per day in the last recorded week were 45 daily. The same week in 2024, we saw 82 daily COVID deaths. Dr. Murphy, your reactions to those numbers?
Yeah, so it hasn't really changed too much. So as the seasonal bump that came up with COVID is now coming down. But keep in mind, even when it's down, 45 people a day are dying from it. So it's around. But the very good news is that it's much less than in 2024. So we keep saying the same thing. It's less than 2024. So it's going to be very interesting to see what happens in 2026. Is it going to continue to decrease as the immunity builds up? We'll see.
We will see. And something that we have seen in this past respiratory season is an unfortunately large number of pediatric flu deaths. Can you fill us in on those numbers?
Yeah, this is very unusual. It was in the national news just this morning. The same story. In this flu season, 216 children have died. I mean, this is, really tragic. We haven't had this many pediatric deaths since the swine flu pandemic 15 years ago. And many more than last year. So it's a startling high number. And it's associated with the decrease in a flu vaccine, which doesn't even work that good, but at least it works. It works up to about half the time. You have to get a new vaccine every year. But and it's approved for children 6 months of age and older. And the child vaccination rate has dropped from 64% to 49%. And so, this is kind of explaining what's going on now in terms of this increase in death. Now, what's happening now to improve the outcomes? The government is funding and working on itself a universal flu vaccine. So we don't know how long it's going to take to develop that. It's been going on for quite a while. But in other words, a vaccine that would cover all the types of strains of vaccine and last for a longer period of time. So that would really be a great thing. And let's hope that works out, because we're using the same old technology for this. And, if we can get something that lasts longer, we can get the flu coverage up much higher. So I think we'll have to rely on the technology here to improve these numbers. But if you look at this season, a little bit, dig down a little deeper, some 47 million illnesses happened in the United States, which resulted in 610,000 hospitalizations and 26,000 deaths altogether. So it was a busy season for the flu and a very dangerous one. In a study of 5,200 adults, 95% had at least one other existing health problem. So, that if you have an existing health problem, you really have to take the flu vaccine. In children, it's a little bit different. And this is why the child statistics are so worrisome. In 2,000 hospitalized children where they had some detailed health information, only half of them had an underlying medical condition at all. So children, just being a child, puts you at risk. So it's next season, consider vaccinating those kids.
Absolutely. And speaking of children and the new technology, there's more excellent real world data on Beyfortus, which is the RSV monoclonal antibody for infants. Can you
Yeah,
tell us those numbers and a little bit about the drug itself?
yeah. So it's an antibody, and it's recommended for kids that are going into their first RSV season, which is in the winter, which is along with COVID and flu. And it's for infants younger than 8 months of age. And what it does is it gives them a antibody to RSV, which prevents infection, prevents hospitalization, and prevents deaths. So it works. And there were multiple studies that were done that showed that it works, and it works great. It's not really a vaccine, it's antibodies. And so, I mean, the impact is quite dramatic. There was a 75% reduction in ICU admissions, 78% in decreased respiratory RSV related admissions, and just in shorter hospital stays if you did end up in the hospital. And high flow oxygen use was less common. I mean, just like every metric that you looked at looked better. So it had a really huge impact. And so that's just very encouraging.
Absolutely. Really great news there. And before we move on from our core respiratory illnesses, there was some more preliminary data about a Moderna combination flu and COVID vaccine. Is there anything you can share about that?
Yeah, so they put it in like one dose together. So you have COVID and you have flu. And we know that if you give the COVID and the flu vaccine on the same day, which I did last season because I had read the initial results of that, you actually have a stronger COVID response. And if you split it up for a week or two, you have the usual response, which is good, but this is better. So they put it in, like, to make it convenient for you, they put it in a one dose thing. And they looked at over 8,000 enrolled and vaccinated patients, and they found that compared to the standard dosing, just like I mentioned before, you had a better COVID response. It's not approved yet. So anyhow, it met all the criteria to get approved among all the influenza strains, and it's likely to be approved now in the 2026 flu seasons. So not the season that's going to start at the end of this year, but a year later, it looks like it will be approved.
Very good. Something to look forward to on that front.
Yeah.
And of course, yes, of course, our biggest stories this week revolve around the measles outbreak. We have a couple of great submitted questions, so we'll start with those. The first being, a viewer says they had measles as a child before the vaccine was available. Is their immunity still considered lifelong? And on top of that, since the virus hangs around in the air for some time, can a non-infected person pick it up and spread it?
Basically, yes and yes. The CDC, it was in the days before the vaccine, before 1957. Basically, every kid got measles. I mean, it's so contagious. One kid in a classroom had it. He or she gave it to everybody in the room. And everyone in the family. And just like everybody had measles. And, we suffered the consequences of that with, 2 to 3 deaths per thousand and hospitalizations and whatever. And it was just part of being in the 50s, So, so if you're born before 1957, you were infected. Okay. Now, if for some reason you wanted to test yourself, say you have an underlying immune deficiency and you don't make antibody well or whatever, you can actually get tested and have the antibody tested for measles. It's very simple. And if your antibody level's low, you take the vaccine again and check it out. So, but you don't, if in just the usual case, which can even include myself, I don't have to get tested because I must have had measles and actually my mother said we all had measles.
Absolutely. And as you noted there, because measles is so contagious, a non-infected person, if they get infected, will absolutely spread
Oh,
the
yeah,
infection.
they're gonna get infected. Mm-hmm.
Now, our next question, also very interesting, says, given the fact that measles affects the immune system's memory, do you think there will be any additional health issues arising from this large outbreak in the next few years? And if so, what could they be?
This is a really good question. Don't really have a super firm answer to it, but measles is a very severe infection. And it alters the immune system. The immune system recovers after measles, but it takes years actually for it to become completely normal. So that's one thing. A very rare long-term complication is, you have to follow me with this, but subacute sclerosing panencephalitis, or SSPE. It's a really bad brain disease, and it's almost always fatal. Fortunately, it's very rare, but it is associated with a prior infection, viral infections, including measles. So, you don't want to get that. I mean, I've never seen a survivor. So, anyway, yeah, it can. It's not as nearly as bad as COVID. A lot more people have long-term problems from COVID than measles, but you can have long-term problems, and some of them, sometimes, rarely, it can be severe.
Absolutely. Very good to know. And if you have had a recent measles infection, something to keep an eye on while you recover.
Yeah,
But
great.
while we're on the top, oh yeah. And while we're on the topic of measles, can you update us on the big outbreak?
Oh yeah, this is really out of control. So there's 935 total cases in the United States. The bulk of them are in Texas, but like even North Dakota had a case recently. And 3 people have died. Now remember, we say 2 to 3 people per 1,000 die. So it's exactly what we predicted. 3 people in the United States have died out of these almost 1,000 cases. And there have probably been other cases. There might be a little bit of underreporting. The CDC has confirmed that 96% of these people who are getting measles right now are unvaccinated. All right. And it's kind of split almost evenly between under 5 years of age, 5 and 19, and over 20. So it just depends basically whether you were vaccinated or not. If you were vaccinated, you have, very low chance of getting it. So this is now all over the world. Canada actually has more cases than we do, and they have a fraction of the population. They've had over 1,000 cases in the first 4 months of this year. They've had an outbreak in New Brunswick, and and again, they're finding the same thing. 84% unvaccinated, or 12% unknown status. So it's everywhere. 11-fold higher in all the Americas. I mean, it's such a contagious disease. So the problem right now is it's sort of in the population now, and there's enough of it floating around that it may be very hard to eradicate at this point without some very strict measures, including mandating vaccines at certain periods for certain people, or mandating antibody testing to see if you're immune.
Mm-hmm.
I don't know if that's ever going to happen, but until that immunity goes up, I don't see this thing stopping.
It brings to mind the smaller, now relatively smaller outbreak that we had in Chicago last year with our larger incoming migrant population, where mass vaccination was able to quell that outbreak.
Right. I mean, they quarantined people, mandatory quarantine and mandatory vaccination, and they got rid of that. But that's what it takes. And, that's basically up to the states. That's the way it works in the United States. The states determine, the public health policy,
Mm-hmm.
not the federal government.
Now, our final story today, a little bit of a through line today, has been some really amazing medical technology. And that is the case for our last story with the newly formulated freeze-dried Jynneos Mpox vaccine. The United States has placed a large order, which is very exciting. Can you tell us about it?
Yeah, so the US put in an order for $144 million for the newly approved freeze-dried vaccine. So I'm very excited about it, but everyone should be excited because if you get that freeze-dried powder, it has a really long shelf life and it's stable and it's just a great product. So it's an improved product. If you have it in the liquid form, it's only stable for a much shorter period of time. So this is just a great technological advance and typical with many other vaccines. So it's just good news to end on here today.
Right. And if we remember back to the beginning of the COVID pandemic, when we were, not we, but people were trying to get the vaccine out and about and everywhere, the
Yeah,
logistics of keeping that cold storage were very difficult. So it just
they did.
shows what big of a step this is.
This is just a huge advance. It's great to see.
Well, on that note, thank you so much, Dr. Murphy, for your time and expertise. Thank you all for dealing with my technical difficulties today. I hope to have them resolved very soon. But if you have any questions or comments, please feel free to submit them down below or at any of our social media in the description.
Thank you.
We'll see you next week. Have a great one.